and it's April, it's spring, even though it does not look like it from my window, but that's fine. That's how it is. And we are starting another edition of our traditional Ask Julie Anything webinar. And as you might know, my name is Mariana Nadai, and I'll be your host today. And we're having another regular AJA session. What does that mean? It means that today our co-hoster and formulator here, Julianne Lee, will answer all the questions you have about your beloved fur family. So you know how it works. If you have any questions, don't be shy and ask Julie anything. Before we start, I want to remind you all about some housekeeping rules. Please switch your chat to everyone so we can all join in the conversations. Use the Q&A box below to ask your questions. Please don't put your questions in the chat. We are reading the questions from the Q&A box. The questions will be answered in order, first come, first serve. I can only see the questions after we start the webinar, so if you post the question before we started, probably I won't be seeing it. And we'll do our best to cover as many questions as possible. And for that, I will also ask for you guys to keep your questions short. Please use just one box of the Q&A to write down your questions. I know sometimes we ask for further details, and that's fine. We can ask you guys, you can write down the details in the chat, or I can open the microphone for you guys so we can chat live with Julie. So thank you for that, for keeping the questions short. And one last thing is the most important thing of all. Actually, the session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. So without further ado, Julie and Lee, everyone.
Uh, Hi everybody. So I guess what's new? I guess we're in a full moon tonight, right?
Yes.
And it's the Virgo full moon. I think we had one like just a few months ago that we were in a full moon too. Remember?
Yes, I do
It was
remember
the
when
it
we
was the worm moon.
warm moon.
And we
Yes.
talked about what that meant for spring and stuff. And this is the Virgo moon. So it's all about transformation and leaving behind things that don't serve you or the higher good of the planet or whatever behind. It's like a transformational moon. So that's interesting. And yeah, and I was thinking about Dr. Zoolittle. I think everybody knows her. Anyway, she sent me a gift, and oh my gosh, she knows that I'm a bit of a seal fanatic, right? Like, I was canvassing for to stop the seal hunt when I was 7 years old, and I've been very political around the seals for a long time. Still am right now. Now that they've reintroduced it, which is just beyond my comprehension that they did that. Well, they did it behind everybody's back. So, but anyways, but she knows how much I love seals. So she gave me this bracelet. She sent me this bracelet. I'm gonna see if you can see it. With a little seal. Do you see the little seal on it? Hold on. Do you see him? Right there. A little white seal. Can you see him?
Yeah.
Yeah, you can see him. Anyways, it's called Faho. I think it's pronounced Faho. Fahlo for anyone that doesn't know. Um, you should check it out. So not only did she give me this, but I'm gonna see if I can find my animal. It's sponsored in it. She sponsored a seal for me. So I can,
Oh,
I'm
that's
trying to
so
find my
sweet.
animal. Where is he? I mean. So there she is. I don't know if you can see. This is a live thing of where she is
Uh-huh.
off of California. So they have trackers on them to try and protect them. And her name is Callie. And she's oh my God, she's so cute. You have no idea. I'm trying to find a picture of her. Anyways, I'll try to find it before the things ended. And I'm in love with her already. I can't believe it.
This is so cute.
I'm looking every 5 seconds to oh, this is the other one, Callie and Alice. I don't know if you can see her
Mm-hmm.
here.
Oh,
I know. Anyways, so I'm every like hour or so, I'm going on my little tracker to see where she is. It's funny. It's so cute. So, anyways, happy spring, everybody. I know, like Mariana said, in some places doesn't really feel like it, but it really does. So I can totally feel that it's becoming spring. The animals are all wanting to be out more, and
yes.
it's so much lighter earlier, lighter at night, so the horses get to stay out a lot more, and the ducks get to stay out a lot more, and yeah, it's amazing. It's nice. We've got Canadian geese in our pond out front, and yeah, finally, it's been a long one. So, do you want to get into the
The
where are we?
questions, yes.
Questions.
Yes,
That's
let's.
the chat. Where's my questions? That's bizarre. Ah,
Oh,
I
are you
can't
not
find the
finding
questions.
it?
No, I have the chat.
Maybe it's sometimes when the screen is kind of small in the Zoom app, you
No,
cannot, you need to make it bigger.
no. I've just got participants chat, react, share. And then when I go into more, um, oh, here we go. Okay.
Okay, good. Okay, so let's start it.
Okay.
I'm reading the first one here for me. It's from Catherine. I have a 1-year-old Doberman who needed conventional medicine for pneumonia. What do you think about rebalancer or any suggestions? Just, yeah.
Maybe she's thinking rebalance her because of the conventional medicine. I'm assuming that's what she's thinking. That's such
Yeah.
a funny question because this just came up in one of our marketing meetings about what does rebalance or detoxify. And rebalancer wouldn't necessarily be good for wouldn't do much for detoxifying the conventional medicine. What would work better would be liver tonic, 100%. Fido's Flora, because of the fulvic and humic acid, helps to chelate the body. So chelation is when it pulls out heavy metals and toxins and things like that. I don't know where you are. Positive immunity is really good for that as well, for removing endotoxins and things from the gut. And I would say, even vital defense, because at the end of the day, what chemicals do is uh, play with the immune system so that the immune system, the ability for the cells to deal with the oxidative stress because of the side effects of the drugs, then what vital defense does is help to strengthen the cells and regain their natural order of living and dying in a proper way, so that you don't worry about getting mutated cells or immune modulated or immune autoimmune diseases, things like that. So rebalancer wouldn't be my first choice to use. You could though use go to, because if he has had pneumonia, then he's going to have, somewhat that inflammatory, um, the inflammatory perspective of his lungs. So you want to make sure that his lung tissue is working to not scar. So sometimes when they get pneumonia, they can get scar tissue, depending on how bad it is in their lungs. So now that I've said all of that, I'm going more and more down of what I think might be the best. What might actually be the best for him is, or her, is liver tonic to help detoxify the drugs. Um, Gut soothe because of the N-acetylglucosamine, and N-acetylglucosamine goes into any smooth muscle, right? Which like the lung tissue, like the lining of the lung, and helps to decrease inflammation to prevent scarring. And the other thing would be your go-to, because then that also helps the trauma of the lining of the lungs, and then vital defense, because our last set of um, research at Dalhousie points to it being a very good lung support, which we're going to come out with all that new research, in the next few months. But that's where I would go with it, especially being 1 year old. You really want to get on top of it so that it doesn't have any scarring.
Good, thank you. And yeah, she mentioned that it was for the antibiotics. That's why she asked.
Antibiotics. So if you put them on gut soothe, you've got the probiotics to help to rebalance the gut. But I would be focused on doing 1 jar of gut soothe so that you're really making sure that you're addressing the inflammation in the lining of the lungs. Then once you're finished gut soothe, then I would go on Fido's Flora, because then you're getting the canine strain, and then you're also getting fulvic and humic acid to work like a chelation therapy for any kind of drugs or the antibiotics.
Thank you. And Danielle is asking here, she has a 13-pound orange tabby. Blood work showed no issues. Lotus raw diet, venison and pork. Throws up food at least 1 time per month. Use feline gut soothe for past year. Alternative Felix Flora, but that seemed to increase the condition. Any suggestions?
Well, two suggestions. Venison pork throws up food at least once per month. Can she put in when she uses the probiotics how it increases the condition? Does he throw up more often than once a month then?
Let's wait.
Okay, let's wait. But
Yes, with Felix Flora.
okay, and what about feline gut soothe?
No change.
No change. Okay, but not more. Sounds like Felix Flora causes more. So when I think about that, then I think about, again, when we talk about the fulvic and humic acid, bringing things out, right? Like a chelation type of issue. So I don't know. The what I would think of doing with this kitty is, I don't know what kind of plate. Can you ask him what kind of plate she feeds on?
Yeah. Let's see. Danielle.
Like what's the full food bowl? Food and
Stainless steel, low profile.
low profile. I would go from just to try, I would go from low profile to a flat plate. You don't even have to go out and buy something new. Just use a saucer from your kitchen and do that for a month. Feed them on a saucer just for a month and see if that makes any change. Don't change anything else. Just do the saucer. The only other thing I could think of um would be to use liver tonic, right? Because even though the blood work is showing no issues, we know that that isn't always a ironclad, oh yes, it's not showing the issues potentially because it's still early on. But, some cats do, throw up once a month. Fur balls can make them vomit once a month. But I don't know how long this kitty's been doing that. But for honestly, rather than buying any more products, anything right now for 1 month, I would try feeding on a completely flat bowl and then try and use a low profile water bowl just to keep any possibility of whisker fatigue out of the picture. And sometimes it will take up to a month. to try that. But I would do that. And then if it doesn't make a difference, I would try I would still keep them on Feeling Gut Soothe. And then I would try liver tonic and go to. That would be so there's just what go to does, I would just do go to um once a day for a month just to see if you can calm down any inflammation in the gut, if that in case that's it, or in the pancreas, or it even helps for trauma if it's early stage or even late stage liver or kidney issues, even though it's not showing up in blood work, because lots of times it doesn't until it's really, really bad, and then it'll show up.
She's asking if to keep the plate at ground level or elevated.
No, completely ground level and flat.
Okay, thank you. Prudence is asking, I have been struggling with yucky, blackish, brownish, sticky stuff in my 3-year-old Boston Terrier for about 2 months now. She has just completed the Yeast Beast protocol. She's doing amazingly after the protocol. I feel it was a success, but I cannot seem to get a handle on the yuck ears that seems to flare after the protocol. I have tried wiping with witch hazel, not using apple cider as she has at times scratched them and made the flap bleed. I have used the coat defense preventative powder. It seems to dry the the flares out too much for her, and then she has a habit of scratching too much. I
Yeah.
can tell that they are bothering her, as I do find her shaking her head and in her beating. I do find remnants of the blackish stuff bedding, sorry, remnants of the blackish stuff that has been rubbed or itched out. I feel
Yep.
that I am lost here on what to do next. I
Mhm.
have ordered the colloidal silver, waiting on its arrival. My question is, can this be sprayed into the ears, or is there a better way to administrate it?
Um, so what I would do is I would order, I'm pretty sure Dr. Judy has it. It's called Zymox, Zymox, and only get the enzyme. Don't use the cleaner, don't use anything. And you can get Zymox with hydrocortisone and without. Definitely use the one without. So I would try using I would order that, and I would definitely try using that. It can be incredibly helpful, like specifically for that kind of stuff. And specifically too, if after the Yeasty Beast protocol, what's happening is that the yeast is coming out, right? So it's it, it it's expressing out as well through the ears. So you don't want to suppress that, but you want to handle it. So Zymox is very good because it's an enzyme in sort of eating that debris, for lack of better words. But don't get the cleaner, don't get anything else. Only get the enzyme, and you put it in there. You don't clean their ears. You put it in their ear. You massage it into their ear, and then you leave it overnight, and that you just sort of flip it back and wipe out some of the debris of the Zymox, like because it's quite oily. And then the next morning you clean out her ear properly, like don't go too deep and stuff. Clean out her ear, and then you add more. And it's pretty amazing stuff. I used to use it in my clinic all the time. I sold it in my clinic, and it's excellent. It's actually very, very good. But the other thing I would use is I would use our go-to, and I would use the go-to twice a day for 5 days. I would also use rebalancer. So I would use go-to and rebalancer. I would both use them both twice a day for a week, and then I would use both of them once a day for another week, and then let our customer service know how you're doing. Because what can happen is when your animal has yeast, especially in the ears, it can be quite irritating, and then the ear canal gets swollen thickened. And then there's less air going down, which is then unbelievably perfect, a perfect house for more yeast and more of that black, gucky, brownish stuff you're talking about. Using Rebalancer, it has silicon thuy in it and it helps to even push it out even more. So she might even get more debris coming out, which is a good thing. More debris. And then the arnica and aconite will take down the inflammation in the help to take down the inflammation in the ear canal. So then you're using the Zymox and those two remedies, and it's like this synergistic approach where you're opening up the canal, you're getting more air in the canal, you're pushing it out more, and you're decreasing the inflammation and the itch. So, and then the Zymox will definitely help with eating the debris. And then colloidal silver was a really good call. I wouldn't put colloidal silver down in their ear. What I would do is put it on a piece of cotton, and I wouldn't do it till after your Zymox is done, or until you can do this until the Zymox gets there. Is just put it on like a cotton swab, like not the fluffy not cotton batten, but actual real cotton squares, or even like ripped up flannel pajamas or anything like that. And then just clean like dampen it with it, and then clean the ear on the flap, and only as far down, like not that it's dripping, only as far down as your finger will go when it's wrapped in the in the cotton.
Amazing. Thank you, Barbara. I believe I successfully kicked Lyme to the curb in one of my dogs recently using Lidom in a protocol I found on Dogs Naturally magazine, but I didn't do it scientifically, meaning did not do an after C6. My only question is this, with ticks already horrific now, is the Lidom protocol something I can use repeatedly, meaning maybe once a year, once I am in early spring, or once midsummer and once late fall? Would this be a safe approach?
Yeah, well, I remember lecturing for Dogs Naturally magazine in I think 2018, and did a bunch of protocols on ticks and different things, and Leadum was definitely one of them. And when you say I didn't do it scientifically, meaning you didn't do an after 6C, meaning you didn't do a six
The
C.
six.
No,
A
well, it really
six.
is a 6C.
Okay.
And that's fine. It's not the end of the world, but I still would. I mean, those little beggars, they kind of stay dormant in the cell, and they can go on forever. So I would do it. I would do it. But to answer your question, yes, you can, it's something that you can use repeatedly if you find a tick on your dog, right? So if you see a tick, I wouldn't wait till you think that your dog's going to get sick. I would do the protocol that you did and follow it with the 6C right away. So I would use that proactively even without symptoms if you find a tick embedded in your dog. Are you in that, Barbara? Can you put in the thing? Are you in the United States or in Canada? Um,
Um,
Put in
New
chat.
England.
Uh,
So
in New England.
US?
Okay. Um, we have her name, and you know what? I don't remember. Remember the woman that has the tick product, the liquid herbal one? You know, right? You know who I mean, but I can't remember her name now. Uh, Barbara, can you so you're finding them on her, I think did the chat say she's finding it on the dogs all I find ticks all the time. Pull at least 6 off this week alone. Ugh. Oh, I
Wow.
know. I know it's awful. Then you know what I would do? I would do what potency did you do? Can you put it quickly in the chat? What potency did you do? Did you do a 1M, a 200? What did you do? She's not. Yeah, and someone just said Rita Hogan has a new course for tick protocols. Yes, that there it is. Sustenance herbs. Yeah, Borrelia. That's what that is the person that I was talking to. She Sustenance and herbs, she's got a really good tick prevention and treatment if your animals do get any kind of tick-borne
But
illness.
Barbara mentioned, I believe it was
A
1
1M.
m.
Yeah. So I wouldn't be doing that high of potency all the time, like when you're pulling um, six off at a time all year long. Would I do a 1M? No, I wouldn't do a 1M. I would do probably a combination of 6, 12, and 30. So I would take 6C, 12C, and 30C, mix it all together, and do a combination of those three. And if you want, you could do a single dose of 1M like once a month just to be it was Stephen Toblin protocol. So I don't know what that protocol is. I'm not familiar with that person. So you could but you could definitely I use that in my clinic all the time. I use it here on my animals with my horses and um but you definitely it was probably a 1M, but I'm just saying I wouldn't use a 1M all the time as a preventative. Because some animals just they become resilient to it. So you don't want to be like blasting in a 1M every single day for the whole time that you've got ticks. I would rather be doing those three.
Good. Yes, thank you. Pat Sumler here. My sweet bloodhound has fat tumors, lipomas, all over his body, but the one on his chest has grown to the size of a grapefruit. Is there any suggestions to get it to stop growing? I'm nervous of trying to aspirate it, worried that it will spread if it's turned into something else. He has gotten larger and more firm. Today is his birthday, 9 years young. Hmm.
Mm.
Happy birthday to me.
Yeah. Happy birthday. I don't know his name, but little bloodhound or Mr. Bloodhound. Um, Size of a grapefruit. That's big. That's really big. I don't on his chest,
Buddy is his name.
buddy. Okay. So, you know me, I don't like doing I don't know if you know me, but I'm not a big fan of doing a lot of aspirations for lots of from what you're saying and aggravating it, spreading cells if it is something else. I don't know how healthy your dog is. I don't know how invasive it is. All I would say is be careful because even tumors that are non-cancerous can become incredibly invasive, even lipomas. And if it starts to come down and impede his motion with his arm is one thing. The other thing, if it gets too big, it could start potentially putting pressure on the lymphatic system, because it's on his chest. So then he could have issues with like his lymph draining correctly. Um, I don't know. It might even be too big to remove. I don't know. Sometimes when it gets that big, then your concern is that you don't have enough skin to stitch up after. But something like this, consider I would consider going to a surgeon. So not to your vet. I would actually have a consultation with an actual surgeon and hear their thoughts on they could do a an ultrasound on this to get a better sense of what it looks like if it's changed from what they thought was a lipoma to something that potentially could potentially be showing something that's a little more aggressive. But if he's healthy and he's got really good blood work and everything, I would consider having just a consult, and they might even say it's too big already. We wouldn't be able to take it off. I don't know. But you would have to just ask the questions, would there be enough skin to, a grapefruit's pretty big, right? On a chest. But in the meantime, what you could use is I would say from everything we have, I would say I would use Fido's Flora along with turkey tail and turkey tail with some specific species in the 14 strains that's in the Fido's Flora have affinities with um, uh, benign kind of fatty lumps and tumors and things like that. So there's been some research come out, some private research and some not private research come out around that. So I would try that, and then I would also try um, a remedy called phosphorus. You can go and just purchase it at a drugstore. And I would just do a 30C, and you could do it, just once a day for a week, and see if there's any change, or even once a day for a month. But before you even do that, I would go and get a second opinion at a surgeon of what they think that might be, because there are other tumors out there that are, and they're going to say, well, we won't know, and this you can't confirm anything unless you do a fine needle aspirate. The problem is that especially with big tumors, a lot of fine needle aspirates aren't even conclusive, right? So you go ahead and you risk aggravating it and stuff. I've worked with, at my vet hospitals, we had incredible board certified radiologists doing ultrasounds, and they were, back in the day, they weren't scared to say things and get sued, right? They didn't have such a um uh big governing body, like, if they're owned by big corporate, like we weren't corporate, so I never had any corporate clinics. They were all personally owned by me. And um and they would often say, in my personal opinion, I can't, in my professional opinion, I can't say for sure, but they would give you some kind of information that would help you then decide what the next thing is to do, right? Like if they did an ultrasound and they saw a lot of like blood vessels or pooled blood or anything like that, right? Then they could say this has the potential for this. They wouldn't give you a confirmed diagnosis, but it might be something to think about, and you just have to say no. No, I don't want a needle in it, and I would like to have an ultrasound done, and then I can rest easy thinking, it's this or it's that. And he could say it's just a lipoma, but it's getting so big, or I can see when I do the ultrasound that it's going to impinge on the lymphatic system, right? And then you have more to go by. And like I said, I am not a surgery girl. I don't, I'm not a big surgery person for sure, unless I feel like it's going to, 100% it's going to give them more quality of life.
Yeah, someone asked it like earlier here in the chat, and I'm just bringing this up because it's related to this question. It's how, like, if the lipomas, it can vanish completely or just shrinking after using turkey tail. So the person was asking this, and it reminded me about the discussion that we had last week too about this.
Yeah. So I've seen in my clinic and practice, I've seen lipomas completely gone, not when they're as big as a grapefruit.
No.
right? I've never seen that. Um, but smaller lipomas, catching them early, quite early, you know, sometimes changing diet. But no, I have seen lipomas completely go away.
Thanks. Joy is asking, our rescue recent took in a sweet pit with alopecia,
Hmm.
probably from a bad diet. What would be good supplements to give her to help boost her immunity?
Okay. So, with alopecia, just make sure that that's all it is, right? Pitties have a tendency, especially if they're rescue and they've been in really bad situations, to get Demodex from stress. It's not contagious or anything, but um, uh, it's something that they can get, and then that you would want to boost immunity, right? If it's Demodex because their immune system is low. Um, but if I think about that and probably bad diet, clearly putting her on either a home cooked diet or um, a diet, a raw food diet, a fresh food diet. And then I would probably alopecia. Definitely, yeah, I would probably put her on Fido's Flora to just get her gut working better, and liver tonic, and probably either Vital Defense or Fido's Flora. One of the two. Those would be the three things I would start her on. One last thing I would do if she's just come into the rescue, I'm not sure what your vaccine protocols are. I don't know where she came from prior to that, but doing a round of rebalancer could definitely help with that. Thuya is really good for just even straight alopecia. Thuya is a really good remedy for that, and Thuya is in that remedy. So you could look at, like I said, you could look at um, Fido's Flora, liver tonic, rebalancer, and either Fido Synergy or Vital Defense.
Thanks. Before I move to the next question, Barbara was asking again because I guess she missed when you were talking about the lidum, um,
Oh,
the potency for the frequent use,
is 6, 12, and 30 all combined?
6, 12, and
12 and
30.
30.
Okay.
And I don't know whether she saw in the chat about that sustenance herbs. And Rita
Yeah.
Hogan's also doing a course.
Amazing. Thank you. So the next question is from an anonymous person. My dog is 13 and has had some health issues, including a sarcoma lump removed. The vet has suggested giving him dewormer medicine. How toxic is the medicine, and is there a healthier remedy that I can give him?
Can this anonymous person type in the chat?
Well, unless the
Oh,
person got in here anonymously, I don't know if the person want to. Oh, yes, I
well,
guess. So Jackie, I guess yes. She said
okay.
yes.
Okay, awesome. What can you tell me why they want to do a dewormer? Like, does your dog have worms? Did they do a fecal analysis and find worms?
I thought it was her, but no, not yet. Let's see. Let's wait. No, they didn't.
No, they didn't find. Hold on. No, they didn't. Okay. Well, I can't go against a vet, like your vet, right? How my rule of thumb here with my own animals, all the animals, my, you know, patients in our clinic, all my horses, which get wormed, most horses get wormed every 3 months. And they're like probably one of the highest, that and chickens are the highest things to get wormed. I don't worm anything unless I see, unless I've done a fecal. and a fecal analysis and see worms and see that they're, out of control. And so, you know, a dog that has just had a sarcoma removed, you don't want, I wouldn't want to, what word am I looking for? I wouldn't want to aggravate, decrease, over increase their immune system in any way, shape, or form. So I don't know whether it was like a fibrosarcoma. Sarcomas are often cancerous. Like I don't know what kind of sarcoma this is. So, but in any case, that when I hear sarcoma, my big thing is prevention and reduction and trying to derail any kind of unhealthy cells, right? And strengthen the cells to to regenerate and repair so that they're not um going into that sort of rogue stage that creates different kinds of tumors and cancers and stuff like that. So I would ask your veterinarian, why do they want to do a dewormer? What's the reason behind doing the dewormer? You can reach out and let us know through our customer service if you want, but wormers can be really, really toxic, very, very toxic, and they can toxic because they're dewormer, they're killing parasites, but they are very hard on the microbiome of the gut. And when you're dealing with some kind of a sarcoma, you don't want dysbiosis. You don't want to shake up or unravel the ecosystem of the gut. That's for sure. So I would, is there a healthier remedy? It depends. Like, does he have worms? If he doesn't have worms, I wouldn't even be going down that road. To me, one of the healthiest ways to have an animal not get parasites is a really, really, really strong microbiome, like the gut, right? Because that's gut and food. So, healthy whole food diets just strengthen everything. Uh, Lots of different bacteria, friendly bacteria in the gut are natural antiparasitics. So yeah, I would just, before I would do anything with them, that's what I would do. And I don't know if you're giving any kind of anything for the sarcoma to try and make sure that it doesn't grow back or spread or whatever. But from that perspective, and I don't know if you're on any kind of probiotics or anything, but I would be using medicinal mushrooms. I would use our Vital Defense. I would use liver tonic and one of our probiotics, probably Fido's Flora. I would be thinking that that's the one that would be helpful in this case. So Fido's Flora, liver tonic, and Fido's Flora, liver tonic, and Vital Defense. No, yeah, Phytophthora, Liver Tonic, Vital Defense. Those are the three products that I would recommend. And the other thing that's really good for that is anytime you're cutting, right? They often, if they're cutting a lump, they're going to try to go past the margins. So they usually do a fairly large, incision. And what you want to do in that case, especially when they've taken out a tumor, you want to do this in any case, but especially when they've taken out a tumor, is you want to try hard to decrease the inflammatory response without decreasing the healing response that comes with inflammation. But you want to create the to reduce the trauma response around that incision so that the cells that are growing to heal that incision are growing in a very, very healthy way. and not overgrowing, causing, proud flesh or a lot of scarring or, even, you know, like I said before, not healthy cells. What can help with that is our go-to, because of the aconite and the arnica in it. It can really help with the inflammation, it can help with pain, and it really can help with the healing process. So there's four things that I would suggest. But to answer your question about dewormer, I wouldn't deworm anything if I didn't know it had worms.
Thanks, Julie. Mary is asking, 11-year-old, 25-pound dachshund, feed, freeze, dried raw, has got cyst for several years. A couple of years ago, had three excised results benign epithelial cell
So,
cysts. Of
yeah.
course, more grew back.
Mm.
September last year started gut tooth rebalancer, liver tonic, phytoplankton, turkey tail, gave a
Regime.
refresher, yeah, turkey tail regime, gave a refresher, rebalancer, and started vital defense and wolf. The cysts have gotten a little firmer, no new ones. Any further suggestion or regime? Phosphorus, maybe? Thank you.
Okay. Um, three, okay. When you gave the refresher of rebalancer, how long did you give it for? Can she answer in the chat?
Let me see if she's still here. Hmm, just a second. Mary, are you still with us?
Well, I can tell her what, hopefully she is still there. But for
Mary
that,
Gates, she seems to be here still. I don't know. Yes, once a
okay.
week, AM 4 p.m. and PM for weeks.
For 1 week or 4 weeks? Let's see. Oops. Once a week for four
Four
weeks.
weeks.
Okay. Once a week for 4 weeks. Uh, you know what? I would keep doing it. I would keep her on you're doing everything right. And if they're gotten a little firmer, what we want to do is we want to try and reduce the scarring because they can scar too, right? Just the inflammation alone in these cysts, they can create a lot of scar tissue and be quite firm, get quite firm, and then not get new ones and not fully go away, but there's little lumps that are left. So I would repeat. I would even keep it on rebalancer once a day for 4 weeks. So what did she say? Once a week for 4 weeks?
Yeah.
Yeah. You could even try doing it once a day for 4 weeks and keep doing what you're doing. Do like the vital defense and the wolf. Um, Last year gave gut soothe. Okay. So vital defense and wolf. Yeah. I mean, that's a perfect combination because wolf has turkey tail in it. Vital Defense has phytosynergy in it, so phytoplankton in it, and chaga. So you're on a amazing track. Phosphorus, yeah, phosphorus is good if some of them are the interdigital cysts, they're epithelial cysts, but some of them can get a little bit hemorrhagic. They can get like a dark sort of congealed blood in them. So you could try phosphorus, or you could also do go-to with arnica in it, or you could just go buy arnica, and you could try arnica as well, just to bring down the inflammation in the cyst. You could just go get a 30C arnica at the drugstore and use that along with the rebalancer just once a day for up to 4 weeks and see how it goes and keep them on everything else.
Amazing. The next question I saw that Emily was trying to answer. I don't know if she, let me just, M. Eileen's question. Can I ask online here? I can go for it. Yes. Okay. Yeah, go ahead. So Eileen is asking, it's another one about lipomas. Any
Yeah.
advice on reducing and preventing lipomas? My 12-year-old for 40 pounds female dog started to get them a few years ago. None are very big yet, but she still seems to be getting more. She is fed commercial raw diet and supplements, green lipid mussels, omega oil, articulate VM, joint supplement, and Chinese herbs. Du Hu Ji Sheng Tang, since she also has arthritis and torn CCL.
Hmm. So has arthritis and a torn CCL. Interesting. Okay, so she's got arthritis, a torn CCL, lipomas.
Do you think it's connected?
Everything's connected.
True. Dumb question.
No, it's not dumb, but everything's connected. And not just as everything connected, I'm trying to look at, when you think about lipomas, for me, I'm always looking at stress levels no matter what. No matter what the physical pathology is, I always look at what's the animal stress level. What's causing that stress because one dog might get lipomas, another dog might get chronic ear infections or chronic bladder infections or one dog could get lipoma, the other dog could get as they get old, another dog could get cognitive disorders. Like it just and one thing that you can look at without going to the expense of big, huge veterinary costs or whatever is my dog stressed? And if my dog is stressed, what's stressing it? So is it an emotional stress? Is something going on? Are you working more? Are you spending less time with them? Or is it pain? So when I look at this, arthritis and torn CCLs, a CCL will increase cortisol levels in the body. When cortisol level gets increased in any body, whether it's a dog, cat, person, doesn't matter. When cortisol levels increase, it affects the way the body deals with fat. So, a lot of high cortisol in people land right in their waist, right around their stomach, right? Fat right around their stomach. I There's all different ways, really seriously, all different ways of looking at this. So I would one make sure that I'm always like, what's her microbiome like? Does she have a good microbiome? Do we know that? Do we not know that? Are you feeding a really good probiotic? Are you rotating probiotics so that she can get different kinds of probiotics all the time, like different, like elevate the ecosystem of the body by going on gut soothe and then going on Fido's Flora, then going on Wolf, then going on Soil and Sea. And you don't do them all together, like don't put the whole kitchen sink into one. You do them one and you rotate them, right? That is how you really educate the ecosystem and the microbiome of the gut. So if she's not on a probiotic, I would put her on a probiotic. You could put her on Wolf, or you could put her on Fido's Flora, or you could put her on Soil and Sea, whichever one you would want. And I would definitely put her on Turkey Tail. I'd probably put her on Turkey Tail and Fido's Flora because that's what we've been talking about, right? So I would put her on Fido's Flora and Turkey Tail together. And then I would put her on Jump for Joints. And the cool thing about Jump for Joints is we created Jump for Joints for CCL tears in my vet hospital. That's where Jump for Joints came from. And when we were using it on all of these, torn ligaments and, partial ruptures and full ruptures and what we noticed is the older dogs with that and cats with that, their arthritis started getting better as well as their ligament, their injury. So I would definitely put her on Jump for Joints. And the nice thing about Jump for Joints is that it has arnica in it. And again, arnica is really good for stagnation, moving blood, um, lots of different things. So what I would try first is Jump for Joints, Fido's Flora, and Turkey Tail. That would be the three things that I would try with your pup.
Thank you, Julie. Alexandra, my cat has lost so much muscle around her spine and hips. She suddenly became very lethargic. I have taken her to the vet, and we are monitoring for a few weeks, and then we will recheck her blood. At that visit, organs came up good, but her CBC showed a low red blood cell count. So we are hoping there are improvements in the next few weeks. Possibilities are autoimmune, arthritis, virus, and hopefully not blood cancer. Can you speak to how I can help her rebuild muscle? I used to never vax my cats, but after 8 years, I was backed into a corner to get ear rabies shots. I'm finally out of that situation, but one cat had three and two of them had it twice. I bought one of your products for this, but it turned their poop gray, so I got nervous and stopped. But I'm open to using it again.
Can you ask her if she got rebalancer for it? Is that what she was using because of the rape? Does she mean because of the rabies shot, obviously, right?
Yes, yes, that's
Okay.
yeah.
Can you ask her if she got rebalancer?
Yeah, she mentioned.
Oh, and it took
Sorry.
poop gray? Wow, that's the first time I ever heard of that in over thousands and thousands of animals that I've had on that. That's really interesting. Not necessarily bad at all. Just that's really, really interesting. So, do you know what I would do? I wonder if they'll eat it. Hmm. I would put these kitties, both of your kitties, I would put them on turkey tail and I would put them on um, Felix Flora and liver tonic. And it doesn't, I wouldn't turn their poop gray. That's so interesting. But I'm assuming they didn't get sick. That's, but she got nervous and stopped. But that is really interesting. Uh, I don't know if your cat's eating, lethargic, lost a lot of weight. Okay. So the best way to build muscle is with a cat, especially, is how old is she? Do we know how old she is? No.
2010. She's 10. Okay.
10. So still young for a cat. I mean, so the best way is once she's feeling better to see if there's ways you can get her to play, to be more engaged, to move around more once she's feeling better. But also, I don't know what you're feeding her, but cats really are carnivores, right? Like they really do need a lot of meat. So meat, muscle, cats, it all goes hand in hand. So I'm not sure if she's on, I mean, if she's, especially if her liver enzymes are fine and her kidney enzymes are fine and all of that seems fine. and she's anemic, or did you say her white blood's her low red blood cell
Low
count? I
red
mean,
blood.
that's also meat, right? I don't know if she would, I don't know if she's on raw meat, a raw meat diet, but I would start cooking if she's not and if she's just on cat food, I would try everything I could to get her on some meat, some raw meat. And if you're worried about raw meat, then because I don't know what you're feeding, then just partially cooked beef, right? Beef liver, beef heart, just to try and get some protein, like meat protein into her. That's going to help with her muscle mass more than I can even say. And and if she's, lethargic because for whatever reason something's going on and her red blood cell count is low, it might help to increase her red blood cell count. Definitely can, depending on what's wrong with her. But arthritis is interesting. That she has arthritis. So I've I don't I mean they can have anemia from things that like they can lose muscle mass from if they're not walking around because they're in pain.
Mm.
So I don't know why you've got arthritis there. I don't know why that's a thing to rule out. But if your kitty has arthritis, I don't know if she wants to put it in the chat. If your kitty has arthritis, that can definitely contribute to muscle loss of muscle mass, for sure. So if that's the case and you're listening, definitely put her on jump for joints, for sure. Cats do well.
She said that my understanding is that arthritis is a possibility.
What did she try?
No, she's saying that my understanding is that arthritis is a
Is a
possibility.
possibility. Then you know what? Again, cortisol levels, stress from the pain of arthritis, muscle mass is a massive indicator for arthritis because they're not moving around, they're not using their muscles, they just lose muscle mass. So if arthritis is a thing, like a real possibility, and she does have or even if she does have arthritis, I would get her on and I'm not saying high protein diet, definitely not like a high protein dry cat food. I would get her on either if she likes a freeze dried raw beef, a red meat, or if you can get her to eat a really good, well balanced raw cat food, or if you can cook her meat for now and get her to eat, and make sure that you're getting different kinds like organ meat, muscle meat, and heart for taurine. That's where I would start for sure. And then slowly move her into like a balanced raw cat food. I don't know where you live. If you're in Canada, Red Dog is my favorite. Red Dog Blue Cat in Canada. I don't know about the US as far as raw cat food goes, but you've got lots and lots of choices. But just use red meat and try and get her on those supplements. And I don't know what her appetite's like if she's feeling so lethargic and stuff. But I would get her on jump for joints right away because that could very well help turn her around from a perspective of pain, and it can help turn her around for her lethargy. And if she's has less pain, then maybe her appetite will get better, and then try to get her on those other products as well.
Mhm. Thank you, Julie.
Oh, poor kitty.
So Julie is asking here, my 11-month boxer just had two separate surgeries for
Tried.
osteochondrosis, and his shoulders in the last 2 months. I gave him Fido's Flora and liver tonic after the first surgery and stopped the liver tonic the last 2 weeks after the second surgery while on pain meds. Should I continue Fido's Flora and liver tonic where he's just couple weeks out from the second surgery? Any other suggestions?
Mm-hmm. Yeah. Um, I don't know whether your vet said to stop the liver tonic or why you stopped liver tonic. I've never been concerned with liver tonic and meds. In fact, that's when I give it the most, is to try to support the liver and kidneys from medications, especially if they're on NSAIDs, which I'm sure um, he is. So,
She mentioned that she never mentioned it to the vet. She just wasn't sure
hmm.
if they should be mixed, so she stopped it.
Yeah. Yeah, no, you don't have to liver tonic, you don't have to worry about it, and you wouldn't have to worry about it with Fido's Flora either. I wouldn't worry about that at all. You know, things with slippery elm and marshmallow root and things like that, sometimes you do have to be careful with, medications and when you give them to be sure that they don't slow down the bioavailability of the medication. But no, those two products, I wouldn't worry about it. But what I would definitely put this puppy on is Jump for Joints, like 1,000,000%. And if he has osteochondritis at 11 months, then I would reach out to a homeopath. And there are remedies like Calc Fleur, Calc Phos, Calc Carb are the three that are like screaming in my head right now to try and slow down, prevent that predisposition of chondrosis. So, and why I'm saying that even though you've had the surgery is because the predisposition is showing up in this way, but you want to address why he hasn't had it. Not just, oh, okay, he's had the surgery, he's going to be fine. I would definitely be looking at that. And but Jump for Joints to try and help him help the joint heal properly, like really heal properly without any kind of arthritis and just give him the best chance. He's just 11, he's just a baby. So that's what I would do. And keeping him on a really, really healthy raw food diet or really good freeze dried or um, dehydrated diet would, is also, just make sure his gut health is really, really good. If you don't have him on probiotics, I would definitely put him on probiotics because he's been on meds. And that is definitely going to create dysbiosis in his gut. So he will have some issues with his microbiome being out of balance now. And you want to make sure that then that isn't going to elicit not something else wrong with him, like skin disease or, or anything. You just want to bring his immune system, you just want to bring that back into balance as soon as you can.
Thanks. Laura, hi ladies. You can probably answer this for me. I have a friend that has a cat with mega colon. This cat is on prescription cable and I'm trying to help her get him off of it. I know hydration is obviously very important and fiber. I was recommending pumpkin and coconut flakes from Cocoa Therapy. It's a US company,
Yeah.
raw diet and Felix's Flora. I read on a chat board somewhere that jump for joints could possibly help. Have you guys heard of that helping? Thank you.
Yes. I had a cat with megacolon. I worked with loads and loads of cats with megacolon in my practice. And it's uh yeah, fiber, hydration, but it's motility. So the reason that you're hearing that Jump for Joints is helping is because when you think of any kind of motility movement, you've got muscles, right? They've got abdominal muscles, they've got pelvic muscles, they've got muscles you want to make sure that their muscles in their tail is also really moving well. Often if they don't have good traction or if they don't have really good uh, motility, right? And some of the motility actually comes from the tail. So what Fido's or what Jump for Joints does is it decreases inflammation and it strengthens the collagen and the muscle and the tendons and everything, ligaments, all of that stuff is really important with megacolon because you want to be able, you want to be able to um, stop that kaleidoscope. I mean, it already is, but you want to be able to decrease it or not make it get worse. So the inflammatory part of it is really, really good. And then using fiber so that it bulks it up and it doesn't back up. It bulks it up, but it stays soft, right? That's the other really important thing. They often recommend Fiberlax, which is like psyllium. So like a psyllium husk. Sarah Griffith, I don't know whether, do we have Sarah Griffith's contact? She's got a really good megacolon constipation um, diet. And and how to exactly soak the psyllium husks and all of that stuff. So that's what I would recommend. And keeping my cat, if he went off of gut soothe, he's on Felix Flora, but I would also mix in feline gut soothe or alternate them. So do Felix Flora one day, gut soothe and feline gut soothe the next day, Felix Flora, feline gut soothe. You're not buying more because you're rotating them, right? And the N-acetylglucosamine for the mucosal lining of the gut is very helpful with megacolon.
Amazing, thank you. Um,
Oh, and
Dawn, oh,
the other reason jump for joints is because megacolon can be incredibly painful, right? It can be really painful, and then they won't try and poop. They try and hold it because it hurts.
okay, oh
So it
gosh.
can really, and I don't know if this cat's ever been disimpacted. Lots and lots of kitties have been disimpacted. And when they get disimpacted or manually disimpacted, it rubs and inflames and can even scar the pelvic canal.
Oh
And then
gosh.
that, when they're trying to poop, makes it more painful. And
Yeah,
jump joints really helps that so they're not as scared to poop.
amazing. Thank you. Dom is asking here, I have a 10-month-old male kitten that is fed raw. He is having issues with throwing up occasionally. His mother and the other cat in the house do not have any issues with the raw diet. He does okay with pork, but as soon as I try to slowly add in a new protein, he has issues. We have tried beef, quail, chicken, rabbit, and turkey. We use A1010 from my pet carnivore, wondering if there is anything I can give him to help.
10 months. Okay. So interesting that he's young, right? So my first thing is that he was probably born with a very sensitive gut microbiome, like a not a robust, diverse gut, right? First thing I would do is put this kitty on a rotation again of Felix Flora and feline gut soothe. So you could start him off with just Felix Flora. Just put him on Felix Flora for a little bit and see. I'm not sure what his vaccine schedule was. Was he vaccinated, as a kitten and then as a 6 month old? And has he always had this issue? Has he been doing this since He was young. How old was he when you got him? I know there's lots of questions. I don't know if Don's still there to ask to answer.
He is. He said he has
Okay.
been on raw since he was weaned, weaned,
Okay.
and we see a holistic vet and is going through FIV now.
He has FIV or he's going through the vaccines. What? Hold on.
Let's see, because
Where is it? Hold on.
going through vaccines, yes.
Going through vaccines. Okay. So, can you answer one more question for me, please? I have to ask this. Is he, does he go outside? Is he an outdoor cat?
No indoor.
I will.
It's another don't.
Okay. So I'm just gonna be really, really straight and honest here. Um, he's 10 months old. He's strictly inside. I'm assuming the rest of your kitties are inside. I'm not sure why he's going through his vaccines because usually they have their vaccines when they're like 8 weeks, 10 weeks, 12 weeks, and most of the time they don't need any more vaccines than that when they're indoor cats. Their risk versus benefits, meaning like the possibility of them getting even anywhere near an animal that they're going to, get a childhood illness from or get, anything else from, you're not gonna be, I mean, you might have to get, I don't know what your laws are there around rabies, so that might be a completely different situation. Um, but I would really, he didn't have issues early on. All kitties are inside. We give a dropper of the FIV
Vaccine
vaccine.
2 times a week. His mother also gets it, and it's not having issues.
Do they have, yeah, I'm really confused why you're doing that if they're inside cats at all, even if his mom isn't having issues. I'm not, unless is it an actual vaccine that you're giving him, or are you giving him a homeopathic protocol for that? I wonder. I don't know. I don't know what you're giving him. I'm not too sure when you're saying giving it to him. Sorry, I don't know much about the liquid. I think it's home. Oh, that's great then. Amazing. As soon as you said that, I was like, oh, hopefully it's a
Yeah,
it's
because
it's a homeopathic protocol for vaccines, which is
they're
wonderful.
seeing like a holistic vet. So
Yeah, but I
yeah.
know. So when you said holistic vet and vaccines, I'm like, what? Okay, so good. That's awesome. If that's homeopathic, that's amazing. Good for you, good for her or him. And so what I would do is I would put, I don't know if the rest of your cats are on probiotics, but I think all animals and people should be on probiotics. And I would try giving him the feline gut soothe. I would do that maybe for 2 weeks. Then I would switch him on to um, uh, Felix Flora for 2 weeks, and I would alternate them like that until both of them are done, finished. It's going to last you a really long time, and see what happens. Just see what happens, and then at the end, toward if it's starting to calm down the vomiting. If it's not calming down the vomiting, please reach out to our customer service because then I can try and help more with that. But I would seriously try doing that. And then once once you're close to the end of those 2 jars, you could try another one, like maybe maybe he's good on pork, maybe turkey or quail. I wouldn't do rabbit or chicken right now. I would try maybe turkey or quail, but only one or the other, not both. And just do it. Don't do like, oh, let's do quail. Let's try. Don't worry so much about rotating your proteins. Just try one so that you know exactly which one does. If he does it, put him right back on pork. Keep him on the probiotics for another little bit, and then try. And if he's not throwing up, I'm saying on pork, then try the quail. But don't be very, very clear. Keep a little record. The other thing, too, I'm going to ask is, are you feeding him on a flat plate? Anytime I have this sort of, um, none of my other cats are vomiting, but this cat does it and it only does it occasionally. I look at stress. I look at whisker fatigue. I look at, because even the low rise bowls, even the low rise dishes with super sensitive cats, it can affect them. And vomiting, occasional vomiting like that, can absolutely be a stress induced whisker fatigue situation. So on top of everything I just said, I would also definitely try feeding this kitty on a flat, completely flat plate.
Yeah, he said that here that I have a spreadsheet going with what I feed daily, and he's fed on a saucer or a flat
Flat
lick
plate, good,
mat. Yeah.
good.
And before they were asking like gut soothe for that they have the gut soothe from the dog. Can he have that too? No.
No,
Just
no, it's
wait
got
for the feline.
it's got aloe in it. So cats can't have aloe, and our dog gut soothe has aloe in it, and the feline gut soothe doesn't. So if you want to try them on the Felix Flora first for a little bit and see, and then try them on, for a couple weeks, and or if you want to try a month of Felix Flora and it doesn't do anything, and then you want to switch over to feeling gut soothe, you can do that too. I'm a rotation queen. I love rotating the probiotics to really build the ecosystem of the gut. But, and I thought by doing that rotation in a month and a half, if he doesn't throw up, then you could try a different protein, just one single protein and see.
Okay, amazing. Um, hmm. Stacy, I have a 13 dash hound with heart murmur and an 11-year-old dash hound with a history of bladder stones. After using Yeast and liver tonic last year, the 11-year-old improved 100%. They both have sensitive stomach. Is there something you would recommend that would help them both? I have been giving Fido's Flora for a month.
Bladder stones. Yeasty Beast or Easy Peasy are they giving?
They said, Stacy said Easty Beast, but makes sense. The easy peasy. Let's see if she's here
Stacy, are you
still.
still there?
Mm-mm-mm.
She went through both
Both
protocols, Yeasty
protocols.
Beast and okay, makes sense.
Yeah.
Um, Okay, 11-year-old, they both have sensitive stomachs. Is there something you would recommend that would help them both for their sensitive stomach, she's saying now, right?
Is there something you would recommend that would help them both? Yes. They
Yeah.
both have, yeah.
Liver tonic and gut soothe for sure if they have sensitive tummies. But if they've got history of bladder stones, you know, um, Easy Peasy is very similar to gut soothe because it has N-acetylglucosamine in it. So, what I would do with these guys is I would alternate one jar of um, canine dog, the dog gut soothe. Then I would go on to one jar of Easy Peasy. I would do Easy Peasy with your puppies 3 times a year. I would go through a protocol of easy peasy 3 times a year just to keep the bladder stones away, right? Like just to keep them at bay. Then gut soothe is really good for sensitive stomachs, and so is liver tonic. So liver tonic, because a lot of sensitive tummy stuff can be from I always call it a lazy portal system, not meaning that you have something wrong with your liver, kidneys, pancreas, or gallbladder, but that they just don't work optimally. And liver tonic is really, really amazing for that. So that's what I would say. 3 times a year, the protocol of easy peasy, gut soothe on a pretty regular basis, and um, liver tonic on a fairly regular basis too.
Amazing. Oh, and she's asking, is there something I can add to reduce the older dog coughing?
He's coughing? Huh. Yeah, huh. I wonder if have you had that coughing checked out? Why is he coughing? I wonder if he's caught when she says he has a sensitive stomach. I wonder if he's got GERD. Why is he coughing? Then I can maybe help. The vet says heart murmur. Oh, okay. Okay. Yeah. So let me go back to your question again. Let me find it.
It's here,
Um,
like I have a 13
the bladder
session
stones.
with heart murmur and the
Yeah.
11 with the
Oh, I
bladder
didn't even read the
stones.
heart murmur. I'm sorry.
Oh,
Of course, that's what it would. Of course, that's what it would be from. One more question. Do either of them have any kind of back issues, like disc back or arthritis?
oh, just side note, she mentioned that she takes enalapril and
For
furosemide.
for his yeah for his heart. But how
No
about
back issues.
no back issues or arthritis? Okay. Um, then how I was saying gut soothe. Gut soothe can help because if he's coughing from his heart, yes, it's from his heart, but the cough itself affects the trachea, right? It inflames the trachea just by coughing. So gut soothe should help with that. But I would put him on go-to, and I would do go-to. I would start off with go-to twice a day for 4 or 5 days. See if it decreases the coughing. If it does, then you can go to once a day and then go to every other day. But if you go to once a day and you go to every other day and the coughing comes back, then just go back on twice a day.
Okay. Yes, there's some few questions left, but I guess we're going through to our last one. It's from Chris. It says, which I'm assuming it is saying bleeding gums and brush teeth every day.
Where's that? Oh, bleeding gums and brush teeth every day.
Yeah, Chris is still here. Don't know if we want more
So
contact.
probably gum disease, right? He's probably got
Hmm.
periodontal disease or gum disease. So what helps with that? It sounds crazy, but gut health is like one of the number one reasons for, other than diet, one of the big reasons for gum disease. So I would give Fido's Flora, and with the fulvic and humic acid, I don't know how sensitive your dog is, but when you brush his teeth, you can actually brush his teeth with the Phytophthora. So you can put a tiny little bit of Phytophthora on, not a lot, but a tiny little bit of Phytophthora on the brush. And or even, you know what might even be better because the fulvic and humic acid is a little bit coarse. Put some Flora in water and then take the toothbrush and dip it in the water and brush his teeth with the Flora and also feed it to him. That would be one thing. The next thing would be either Vital Defense or phytoplankton, the phytosynergy. It's both of those are really good for gum disease. And not sure how old this I think it's a dog. I don't know, maybe it's a cat.
I would say a dog, considering that it's brushing
I
your
know.
teeth.
I know, that's what I was thinking.
Little hard, like to
But
brush the
I
cat's
know
teeth.
people that brush their cat's teeth and they're fine. I wouldn't have fingers if I tried to brush my one cat's teeth. But I don't know. I wish I knew a bit more because bleeding gums and brushing teeth, if he's got dental disease, I don't even know how many teeth he has. I don't know what breed this dog is. But one of the most amazing things for gums and teeth is holding on to a raw chicken neck. So if you're feeding a raw food diet, then they can eat chicken. They're not allergic to chicken. You put a glove on so that the it doesn't slip out of your hand, and let your dog chew on the chicken neck or your cats. This is great for cats too, if they'll do it. Or sometimes you just have to leave the cats alone, but with their necks. But you take it, you pull it way to the back and while they're chewing on it, you move it around and then go to the very back and then move it around, go but to the very front. Because what that does, it's almost like flossing,
Mm,
right? So it actually massages and exercises the gums. It exercises the mandibular joint, which actually helps with blood flow and, tooth health, gum health. And then the probiotic is incredible for that kind of um, uh, for bacteria and stuff with the gums. And the other thing you can use for bleeding gums too is you can spray on colloidal silver. So you can
mm,
get our colloidal silver with a spray, and you can spray on the colloidal silver after you've brushed their teeth. That can help too.
amazing. Thank you. Well, we still have six questions remaining, but it's getting late, right? So
I know. You know, there's not that many left. They could all send them to
to
customer service, right? All
yes,
these ones
yes,
could definitely go to customer service. They can send them to me and there's not that many, right? There's only
yeah.
six or
Uh,
something left, which is great. So why don't you just everybody just send your these exact questions to customer service. I normally do, when am I doing customer service next? I don't even know.
Next
Tuesday.
Tuesday. Yeah.
Next Tuesday. And I will try and get to these questions next Tuesday and get them back to you for sure.
Yes, so I was even going to say that every time that we have some remaining questions, I like to say that we understand how frustrating it is to not to come here and wait until you have your questions answered. So we really want to help you guys. One way to help you is sending the questions to questions@adorebees.com and our amazing customer service team will help you guys. We also have we are part of the Adorbis Collective. It's a Facebook that we created, but the community there is amazing and it's very helpful. So you can post your questions there, and everyone there will be glad to help you. And we also always have one person from our team monitoring the questions, so we are always there too. And I guess that's it. I would like to thank you, everyone who joined us today, and thank you, Julie, for your
Welcome.
precious time
There's a couple questions too in the
in the
chat.
chat. Uh-huh.
So those people can also
Yes.
send them in, especially if there's a horse question. I can definitely help with the sciatica question with the horse. So
Amazing.
if they want to send that in too. And then one thing I was really happy to see is from Joyce from Stouffville. She was on the last one. Um, Bobby is much better, is only thrown up once in March. So that's really good. I don't know if you're still on there, Susie Joyce, if you're still on there, on here, if you could send customer service what's happening, I would love to know how he's doing.
Amazing.
Okay.
Yeah, I guess that's
So
it.
thank you, everybody. Go
Thank
out
you.
and go
Yes,
out and send wishes to the moon
to the moon.
and
Yes.
clear your negative thoughts, surround your beautiful animals with white light and yourself, and give yourself a pat on the back for showing up today and really caring so much about your animals. Thank you.
Thank you. And I wish you all a great night. And remember to subscribe to our newsletter. You can sign up on our website to get all the information about Outdoor Bees, our promo, new blog postings, and future Ask Julie Anything sessions. And that's it. I want to also
Okay.
say goodbye. Thank you
Bye.
everyone for joining
Thanks.
us. Have a great
Thanks.
night. I
Thanks,
hope,
Mariana.
thank you, Julie. I hope we can all feel the warm breeze soon. I know some people are already feeling it, and I hope we can also be feeling it soon. So that's it. Thank you again. Have a good
Okay.
night. Bye,
See you
everyone.
later. Bye.